Hello, Chris Grimmond speaking, founder of Omaha Insurance Solutions. My father was a Korean War vet. He served on a tin can minesweeper along the coast of Korea during the war. As kids, we were always fascinated by that. We'd see pictures of him in his sailor suit, his other comrades in arms. Dad never talked much about it. The last 3 months of my father's life, he spent it in a VA hospital. He was terminal, he had all kinds of issues, and we knew it at the time. My brothers and I kept vigil at his bedside. The morning he died, I was sleeping by his bed. It was about 3:30 in the morning. The nurses woke me up and told me my father had passed, called my brothers, and we spent some time around my father's body. Then the nurses came in. This is different than ordinary hospitals. The nurses came in, prepared his body, and covered it in a flag. My brothers and I escorted my father's body down the hall to the elevator, ultimately to the funeral home. And as we're going down the hall, they blew the PA system, sort of a little taps almost, and announced that another warrior had fallen. And so my brothers and I are incredibly grateful to the VA system. Later at the funeral, they had the honor guard there, fired off the volleys, and the captain of the honor guard handed a folded flag to my brother, second oldest. He's a lieutenant colonel in the National Guard. And the officer said, "On behalf of a grateful nation." And those words really stuck in my mind. And so I say to you, on behalf of a grateful nation, you have, as one of your benefits, medical coverage through the VA system. Now, what I'd like to talk to you about in terms of those VA benefits is three things. First, what do you have? You need to know that. Second, what are those limitations around your VA benefits? And third, how VA benefits can work together very well with Medicare to fill in the gaps and to enhance your overall health coverage. Now, in terms of your VA benefits, what do you have? Never assume. You want to find out, because your benefits are based on a number of variables. Time in service, when you served. Did you serve in a war area? Do you have any service-related disabilities or illnesses, post-traumatic stress, some injury, whatever the case may be? All of those things affect the type and the extent of your benefits, whether you have copays or not copays, your income, all of those kinds of things. So you need to understand exactly what your benefits are. Second, you need to understand the limitation of your benefits. Will they cover things like emergency room service outside of the VA? Will they cover other sorts of specialists outside of the VA? What's the extent of those benefits? Because the best example I can think of is the emergency room. What happens if you have a heart attack? You have a stroke, you're in a car accident, whether in your area, like if you're here in Omaha, or traveling. You go to a hospital because they're going to take you to the hospital that is rated to handle your particular illness. They're not going to take you necessarily to the VA. And in the case of most VAs, certainly here in Omaha, it's not rated for trauma. They're going to take you to another sort of hospital. And if you don't have Medicare, or you only have Medicare Part A and not Part B, that bill you get from the emergency room will be quite extensive. And so you need to understand the limitations of your VA benefits. And then third, Medicare works very well with VA benefits. If you're going to the VA, fantastic. If you're comfortable with your doctors at the VA, that's wonderful. Keep going. If it's not broke, don't fix it. But the advantage of Medicare, Medicare A and B, is that you can go other places. And so if you have Medicare, Medicare Advantage, or Medicare, original Medicare A and B, and you go to that emergency room, you're going to have coverage. It's going to limit what the charges are. If you have Medicare Advantage especially, you will have a very, very minimal copay. And that's not simply the hospital in your local area, but if you're traveling somewhere else. And so Medicare Advantage can give you that extra benefit. Also, let's say you want to go to your family doctor and you don't want to wait to go to the VA and make an appointment months ahead of time. If you have Medicare Advantage, then you're going to have that flexibility to do that. Let's say you get cancer. It happens. And so you want to go to an oncologist, not one at the VA, but somewhere else, the best in Omaha, the best in the Midwest, the best wherever. If you have Medicare Advantage, you're going to be able to go there without any concerns about costs. The costs will be much, much more controlled if you didn't have Medicare. And so those are the advantages really of working with not only the VA, but VA and Medicare. I'd like to thank you for your service, and I would encourage you to find out what are your benefits, what are the limitations, and talk to a professional insurance agent who can help you understand how those benefits would work with Medicare. Thank you. Chris Grimmond at Omaha Insurance Solutions.